Hi, I'm Dr. Bruce Karlin, welcoming you to another edition of Health Matters, brought to you by WCCA TV and the Worcester District Medical Society. It's my pleasure to have Dr. Michael Hirsh and Karyn Clark, respectively the Medical Director of the Division of Public Health in Worcester and the Director of the Division of Public Health in Worcester. Did I say that correctly, Karyn?
You did, thank you.
Welcome to both of you, and of course, the thing on most of our minds right now is COVID and what we're doing about it. And fortunately, we have these two helping us navigate through troubled waters. Thank you both for being here.
It's really a pleasure, and it's always great to be with you, Bruce.
So I was thinking back, and I just want to show this. I know this doesn't show up very well, but we have our community immunity buttons. Way back in 2007, the three of us worked with the Worcester District Medical Society with the original push by the Medical Society to make a dent in future pandemics. And we had, through the District Medical Society, the Department of Public Health, the University of Mass Medical School. We had the med students working with us. We had the School of Nursing working with us. We had the Women's Auxiliary of the District Medical Society working with us. I can't remember. Do you remember? We had the Emergency Medical Services.
We had the Medical Reserve Corps.
With Karyn Clark and his group.
Yep.
We did a whole approach to saying, there's going to be a pandemic, and we gave 2,000 shots to the elderly in 2 sites on October 13th in 2007. And you both were huge parts of this way back then. And I was thinking, what's changed since then? Maybe we could talk a little bit about what happened. Why didn't we pursue that more? And say, let's get ready for this. And instead, we went ahead and we decimated our Department of Public Health. We went from 100 people in the department down to 4 and said, all right, UMass, pick up the slack. What do you think? Are there lessons to be learned on that? And are we paying for that now in terms of the rollout?
Well, Bruce, it's a complicated question, and probably the emergency specialists like Karyn Clark, who you mentioned, who's now a senior vice president at UMass, handling emergency preparedness and emergency response. That's quite a power couple there, Karyn.
Yeah, we know about them.
And he would probably advise, hey, don't do a hot wash, don't do a review until we're really done. We're not really done. But I think there are some things that we have certainly observed in that we reconstituted the decimated Department of Division of Public Health in 2000, starting in 2010, after the then city manager had put together a task force, and Karyn and I were on that, where we went methodically for a weekly meeting, a 2-hour meeting every week for like 9 months, and we came up with these different boxes that we had to check off. And one was becoming much more lean but smart, so brokering different kind of relationships with the different institutions of higher learning in town. That we call now the Academic Health Collaborative. So we can call upon them as we are now. Right now, Worcester State is standing up as a vaccination site. We have different colleges helping us do the vaccinations. Certainly UMass is one of those institutions of higher learning. We also talked about becoming federally accredited, which Karyn squired us through. We became the first nationally accredited Department of Public Health in the Commonwealth. We were also advised that the home rule kind of setup that is in so many other aspects of Massachusetts life, where there are 351 towns and each has their own little police department and fire department. We were going to try to show how a regional response would be great. So we recruited 6 townships to be part of our regional health district, and we were the first one in Massachusetts to do that. And then we also became, I think, a lot smarter about being data-driven. So we got a lot of data about what was making Worcester sick, what was killing people in Worcester, and we crafted that as a community health assessment that then led to the creation of a community health improvement plan. And that was giving us a roadmap to do better community public health than we had been. We'd been doing all the important things of, water and sewer and all these other things. That was kind of taken away from us after this fall, and the Division of Inspectional Services took over. So we were really charged now with really looking after the kind of things that we were unfortunately beaten down with last year when the pandemic struck. And Karyn can tell you how much organization and collaboration it took. But I think we did develop a much smarter approach to public health. We weren't responding just to complaints on the telephone of too much goose poop in Elm Park, right? Mm-hmm. We were instead saying we had a roadmap, we had a guiding principle, we had a vision, and we were going to stick to that.
Well, I'm impressed, given how far back we went in 2010, whenever we decimated the department, to now being able to mount a response in as short a time. So it's really been like a month that you've had to go from zero to full speed ahead on the vaccine. And of course, there naturally a whole bunch of processes we could have put in place had we been doing this right along. But I'm impressed that you've got it going as much as you have. Do you want to speak to that, Karyn?
Yeah, sure. So thanks for having me on, and really it's an honor to be here with you in 2021, and also Dr. Hirsh, and to really wear these buttons and remembering wearing these buttons back in 2007. So I think Dr. Hirsh did a really nice job, sort of providing context about where we were with H1N1, and then what happened with public health, and then all of the steps and all the people involved to get us back to where we are today. So to be able to say I was one of those 4 individuals, and now I am the director of 26 professionals, is really a proud thing to be able to say, and we have an amazing team. So while we were reconstituting, we ended up securing additional funds through the State Department of Public Health, their emergency preparedness program. So we're still doing a lot of regional work. We have Alyssa E. Reddy in our office, who is our chief of emergency preparedness, who behind the scenes always over the years has really worked with hospitals, so 11 hospitals in Central Mass, and also 74 boards of health in Central Mass, always talking about responding to pandemics or some kind of a public health emergency. So even though the funding has sort of ebbed and flowed, public health has really been at the table with hospitals all these years planning for these things. And so we are able to, not just Worcester, but really smaller communities, use the training and all of the partnerships that we've developed really since 9/11 to be able to pull things together, really not only on a shoestring budget, because there is no budget, but also that passion to come together to get volunteers and really respond to the community. So it's been really wonderful to be able to take all of that, and again, going back to H1N1 and putting that back into motion. So very quickly, we were able to stand up our first emergency dispensing site clinic, which was for first responders. So as you know, we're a regional health district, so Worcester DPH, emergency management, a lot of support from the city manager's office. The manager's been embedded with us for a year on the pandemic response, and Dr. Castile, our Health and Human Services Commissioner, to just, quickly, I think in 9 days, we stood up the site at the Worcester Senior Center, came up with an appointment system, learned how to handle this new vaccine, 2 new vaccines, and, train people, and to get those academic partners that we had back in 2007 to come back to the table and help us to vaccinate and just to even get people, through.
Do you think that our exercise in 2007 helped us? Because that was Dick Agababian's vision.
That's right.
He was our president at the time, and he said, let's do this community immunity. And then, unfortunately, he got very sick. But his vision was propelled by the likes of you two and other people pushing it forward. Do you think that exercise was Dick's vision correct in saying, hey, let's do this once and we'll be able to build on it?
Oh, I can't tell you how many times we've referenced this over the years. And of course, we've been discussing it now with some of the younger staff that are on board across all the departments that are helping us. But yes, because if you're not drilling and you're not talking about this and sort of putting, whether it was H1N1 or using flu vaccine to practice as a drill, then there's no way that you can stand something up in 9 days and have it seem like a seamless type of an event. So absolutely, those were lessons learned that I've carried with me for 13 years, and use that to teach other people in the department. It's essential. I think we have to continue to be able to drill, and I'm glad we did, because look at what we're dealing with now, and it's this very long, protracted event. So you don't want to be figuring this out for the first time when you have a pandemic, especially after a year of being on the ground, responding, contact tracing. We're a lot of public health people, including our team, we're very, very tired. This has been 14-hour days, 7 days a week, again, for the city of Worcester, second largest city in New England, and 5 other communities. This is a very dedicated group of people. And then after, 8 months in, to then say, okay, still respond, still make, do contact tracing, call people. Oh, and now these people don't have food, they can't get out. This person needs diapers or formula. I mean, this isn't just about the shot. This is real people that really are in need. And it's the people who can't necessarily get out to get the vaccine is really what we're starting to pivot towards, to really look at equity and making sure that people can access the vaccine, going out into the community, but really also looking at communities of color that have been disproportionately impacted by COVID. That's not really something that we talked a lot about back in 2007, but the pandemic has certainly illuminated all of the social determinants of health and all of these pieces of inequity that are really part of the fabric of public health now. I mean, public health, the whole landscape has changed over the years. I never thought we'd be issuing permits for medical marijuana dispensaries. I mean, it's really changed, but this is so interconnected with our work, and so that's sort of been this whole other piece that, we've been working on and that we're pulling together as a community as well.
Mike, I just watch what's happened and say, how in the world did you ever get this done? I know we did some things that I thought were pretty impressive way back then. We started teaching medical students actually how to give vaccinations, which actually we hadn't done appropriately until the School of Nursing came and said, you guys need better training than you've ever had. And we started that with community immunity. But I now watch, and I'm in total awe. People call up and they say, well, it took me forever to get on the website, or I didn't get on the website. And I said, you've got a vaccine in less than a year, and you're going to get vaccinated this month somehow. Mm-hmm. I just don't know how you guys are pulling this off.
Well, I can tell you, the sweat equity that Karen referenced with all of the folks in our department and in the emergency management group and in various other leadership roles in the city have all pitched in. You know, we have personnel from all of these non-medical, non-public health departments pitching in various roles, helping us stand up these clinics. I think you're exactly right that the model of the nursing school teaching the medical students to vaccinate was on my mind since April. In April of last year, I called Jill Terrian, who had been one of the nurses that had helped to vaccinate back then.
Right back then, yeah.
And I said, Jill, we're going to need an army of vaccinators once the vaccine comes. And she actually developed a course for her graduate nursing students that they took over the summer, looking into past pandemics, looking into best way to do mass distribution of vaccine. And as part of their course, they agreed to become the vaccinator trainers. So January 9th, with the help, again, of Karen and Karlin Bolin, who's our deputy director, we ordered a whole bunch of supplies just for the training piece. We set up ourselves in the actual vaccination center 2 days before we actually started giving real vaccinations. We used the same prep area, and we trained now in 3 separate trainings close to 650 people. And in addition, just like in days of old, the Worcester District Medical Society stood up, and we got 70 retired and some semi-retired docs and nurses to volunteer to be part of our vaccinator corps, which has been huge because the med students need to have one of those licensed people for every 10 of them to work off their license. And so it's just been great. And it's been so great that as soon as we train them, we lose them because they're getting sent all over the Commonwealth. You know, Marty Meehan, who's the president of the overall UMass, wants our institution to stand up as the Commonwealth's medical school. So they're going to East Boston, they're going to Athol, they're going to Pittsfield, they're going to Lawrence, they're going to Fall River in groups, some of them mobile groups and some of them to emergency distribution sites there. But they're like our best ambassadors, and I know that they're really well trained because that's something that graduate nurses do so well. They did a
fabulous job back in 2007. So, Dr. Michael Hirsh, tell me about some other things that have happened behind the scenes to get this going. I understand you pushed Dr. Abraham to help us out with getting retired physicians involved.
Yeah, he reached out to a number of retired physicians from St. Vincent's. You know, Bruce, this is all stuff that you were advocating for as president of the Worcester District Medical Society for years. The Worcester District Medical Society has always been a place where you drop your affiliation at the door and you just come in and you're just a physician talking about patients, right? That's what I've been trying to do this last year. Every other Wednesday, I have a call-in with the 2 federally funded community health centers and the 2 medical centers and Reliant Medicine. And you know, we are all great friends now after, you know, some awkward sessions where we actually share, you know, the things that are going well, the things that are not, how can we help each other? And we're all sitting around saying, why haven't we done this all along? This is the lesson of the District Medical Society. We could have learned it a lot easier than waiting for a pandemic
but the
to
pandemic
do it.
Helps.
But everybody has this sense of purpose and urgency, and they're all chipping in. And I think that's how the city has been as well. All the city agencies have been so generous with their personnel and their time. But it's also a large degree because Karen and the city manager and Dr. Castile and Colleen have been going out to the Department of Public Works and to the various different departments in the city to kind of keep them abreast of what's happening. And I think that information flow, plus our little gigs as a weekly press conference that I participate in with Mayor Petty and City Manager
That's important,
Augustus.
though. I mean, you sort of say, you pass it off, but it's really critical, because a lot of the important information is getting out there, and we got to get people to understand. Listen, if all the doctors are getting shots, they got to be good.
Yeah, and Karyn is working on several programs to try to, overcome hesitance and that kind of reluctance, either from folks that are like just traditional anti-vaxxers or folks in the community of color that have some, distrust of the medical system, for good historical reasons and the structural racism that we've all been trying to overcome. But it's tough to do in a pandemic.
There's a small element where people are a little bit wary of big pharma, that they don't share everything. And there's more than a kernel of truth to that. But this pandemic is the virus is so serious that I'll take my chance with an anaphylactic reaction, 1 in a million, versus whatever it is, 1 in 200 if I come down with COVID of dying. And I think getting that information out and saying, look, it's always for everything is a risk, but the odds are overwhelming in your favor to get the shot. And any of the shots right now seem perfect. Can you speak to that? Either one of you, Karyn?
Sure. So I will just share that Dr. Hirsh and I are part of what is called a COVID vaccination support team. So we've been working with the Health Foundation of Central Mass, who put up some funds to look at how we can collaborate with the community and have really authentic conversations through trusted community partners and community organizations. Dr. Castile and members of UMass, in particular Cheryl Lapiore and Monica Lowell, who's a dear friend and colleague, who were very invested in the testing piece and still are, they are part of this sort of quasi-city UMass Health Equity Task Force that has really been meeting since the beginning. And they have invested a lot of time and resources into really understanding, even why people would be hesitant just to get the test. And so because they've built those relationships, which now we're tapping into for this campaign, we're trying to understand the hesitancy. And again, there's a lot of reasons why, and some of them are historical and some of them are just total lack of information, or the way things get packaged up don't necessarily make sense culturally for other folks. So we're just trying to understand what the hesitancy is, so that we can focus on acceptance, and what makes sense to us does not necessarily translate to others. So just being really sensitive to that. So we're working on a campaign that would try to address what are those concerns and package up things on a website that would have a repository with some of this information.
So maybe, Dr. Hirsh, maybe you can allay some fears by telling what you know about the safety of the vaccine and the efficacy.
Right. I think the biggest piece, Bruce, is that people think it was like cooked up in a bathtub sometime in May, and this is built on the experience from so many other outbreaks, SARS and SARS-1 and MERS and Zika and Ebola. All of them together gave the knowledge to be able to push the button and say, okay, now we have our target. We know what we're going to build here with this mRNA platform.
So it didn't happen over a year. Everybody says you developed the vaccine in a year. And in fact, the Gates Foundation started funding. They put, $1 billion up with matching grants from countries for $3 billion more to study vaccination. back in 2003 when that was the original SARS,
That was the original SARS.
and then MERS came
MERS
when?
was like 2 years later, 2005, and then we had swine flu, 2009.
So these messenger RNA vaccines are a huge breakthrough and provide much more immunogenicity than they have a bigger response so that you're immune, much more than any of our other vaccines ever have been.
The 28th of February is the anniversary, 1953, of Watson and Crick's discovery of DNA. And I don't even think anybody had any idea how important that discovery was going to end up being. But it's going to save thousands of lives this year. Unfortunately, 500,000 lives didn't get it in time.
But, we've all had our second dose, so, obviously we believe in the efficacy and the safety of it and would recommend that everybody get it. So we've only got a couple of minutes left. So do you have Karyn Clark or Dr. Michael Hirsh, do either of you have important things that you think you would like to leave the public with at this time?
No pressure at all. No, just kidding. So I think it's clear that there's been a lot of challenges with the vaccine rollout. We're seeing this every day on the news. And again, this is new for everyone. And as our city manager, Ed Augustus, says daily, but it applies in every time he says it, is we are building the plane as we're flying it. Even with all of that training that we had, this is just a massive undertaking. And of course, 2 shots, 2 new vaccines, all of this. I would just say that, people need to be as patient as they can. And I know that's really hard because people are scared. People have been waiting to see their families for a year, hoping they can get this vaccine. The supply and the demand is the issue. Everyone will have an opportunity to get vaccinated. It's just going to take a little time.
Needles in arms
Yes.
is the way.
The arms race. Well, thank you all again. This is Dr. Bruce Karlin for the Worcester District Medical Society and WCCA TV with our guests, Dr. Michael Hirsh and Karyn Clark of our Department of Public Health here in Worcester. And thank you both for being our guests here tonight. I think we got a lot of good information out.
Thanks for having us.
Thanks a lot.
Thanks again.
Great to be here.